Hello, good morning, good afternoon, good evening, wherever you are in the world. Welcome to the first webinar by Menaca to celebrate you. Today, we have a seasoned speaker who is Dr. Naushad Khan, who is also an associate professor and a consultant doctor in the Department of Emergency. Over to you, Dr. Khan. I'm so looking forward to hear the myth busting of COVID-19 and vaccination. Thank you. Thank you so much for listening, and we will go into the question time. I have had lot of questions coming already, so I am going to be asking those questions first, and then go for the questions what is being asked. Thanks for the patience, Dr. Khan.
Yeah, there are so many questions. I already collected a few as well. Yeah, you can go through, then I'll catch from there. Please.
Sure.
Please.
The first question is, do COVID-19 vaccines provide long-term immunity?
We don't know. So I'm going to give a very honest answer. According to the WHO, we don't know how long the immunity will last in our body. So I believe that is the answer I can straight away. We don't know, maybe 3 months, 5 months, 1 year, we don't know.
Sure. Okay. Thank you. Do they protect from all viral infections?
No, this vaccine specifically designed to prevent the COVID-19. That will not prevent the flu or any other infections. So for those infections, you have to have a different vaccine. So the message is, if somebody, elderly person or whoever, if they are taking this vaccine, don't think you don't need to take the flu vaccine. Yes, that's the answer.
Thank you. How effective are COVID-19 vaccines?
So far, the information we received, different vaccines are giving a different effectiveness, but I'm going to give a general answer, which is reducing the hospital admissions, from the Israel, 60% the same situation in the UK. So it's more than maybe 60-70% effectiveness minimum we are talking about. Okay, but anyway, some of the vaccines are more, some of the vaccines are less. I'm going to highlight one point. This is a great achievement. If you take the flu vaccine, so far we are using from 1950 or whatever, and this vaccine only 50 to 60% effective. 50 to 60% effective. So this is a 95% effective. When you are talking about, it's like a gold medal. I can't tell you anything more than that.
Sure. Yeah. Thank you so much. Can a person who has received the COVID-19 vaccine get COVID-19?
No, as I already mentioned that we are now, our audience are almost expert. There are 4 different types. The first one, we are sending the mRNA, not the virus. The second one is we are putting the mRNA into another virus which cannot cause the disease. And the third one is just we are sending the spike protein, third type. The fourth one is we kill the virus and send. So none of these viruses will not produce any COVID-19 disease.
Okay, thank you so much. I'm just going to go through the questions very quickly because there are plenty of questions.
Yeah.
Can a person get COVID-19 infection through vaccination? And if a person already had COVID-19 and recovered, do they still need to get a COVID-19 vaccine?
According to the WHO, yes, we need to get the vaccine. I believe I covered in the presentation as well. If somebody had the COVID-19 and the immunity will last only maximum 90 to 150 days. It's a depend on the person. Some people that will disappear very fast. So the WHO recommended we have to give the vaccine for everybody.
Sure. Thank you so much. Do COVID-19 vaccines protect against the various strains of COVID-19?
My answer will be yes, some extent. I already mentioned that when that mutation happened, that doesn't change the full spike protein. Okay, I'll give you an example. These are the spike proteins. Now, the original one is coming and connecting like this. If there are any mutation, now one finger is out, you can see that, still that will connect, okay? Not completely unconnect or something. So, still this vaccine will work some extent. So the better have this vaccine at least to give some protection. So by the time the technology is changing, they will produce the vaccine accurately for that particular specific the variant. That situation will come. Yeah.
Sure. Thank you so much. Are there side effects from this COVID-19 vaccines? I for one took the vaccine and I did have some side effects. Nothing serious or nothing major. So these are the questions I have collected from everyone. Will there be side effects?
If you take a paracetamol too much, you will get the side effect. Okay. So any medicine will bring some side effect. The question is that side effect is dangerous to our body, or will they have any long-term effect or something? That's the question we have to ask. After taking the vaccine, we will have a mild fever, some arm pain, maybe for a couple of days, and a little bit low mood, and all, maybe tired. And all these things will disappear after maybe a few days' time, 2-3 days' time. That's not a long life. That we should be happy about that. If you get those symptoms, that means the vaccine is working. If it is not working, you will not get anything much. But anyway, so that's the thing. You will have some side effect, nothing serious so far reported.
Okay, so thank you. So I can go and celebrate that I did have some side effects. Thank you. Can one vaccine be interchangeably administered with another vaccine?
According to the WHO, you have to stick with the same vaccine. For example, if you take a Pfizer vaccine, the first dose, you have to take the Pfizer vaccine, the second dose. You can't means not recommended to take the different type. This is according to the WHO. I'm not telling anything. Okay. Sure. But maybe in the future, they might do more research and do the things. Yeah, go for it.
Sure. Perfect. Thank you. COVID-19 vaccine is available. Does it mean the pandemic is over?
Not really, because we have to, first of all, until we reduce the hospital admissions and the spreading capacity, and maybe bring the death rate down. So infection still there, and also WHO did not confirm how much this vaccine will prevent the infection from the vaccinated person to a next person. According to the WHO, no clear data yet. So we have to follow whatever we are following at this stage.
Sure, thank you. The vaccination program, is it really effective? Does it work? Because
yes, of course, I already
the death rate is still high, so people are wondering, is the vaccination program is effective?
Yes, that's a really good one. Basically, we just now started the vaccines. Vaccines will not cure whoever already had the virus or already had the infection. That's not a curing medication. It's not like antibiotic or something. So whoever already had the virus, they will go through the things. That means probably they would have infected 7 days ago. And those areas, they were not vaccinated yet. So there are so many factors involving in this. So this will take some time to bring this rate down. So that does not mean vaccine is not working. So that is working, but that will take some time.
Sure, thank you. So what is COVAX facility?
Yeah, that's a very interesting one. COVAX is some sort of body connected with the WHO to support the developing countries. If you see that, and there are 190 countries supported by the COVAX program. And for example, Sri Lanka will get 20% of the vaccine, the stock through this COVAX project. So they will be able to get some support, because the poor countries needs to be supported, developing countries. So that is the COVAX. That is part of the body connected with the WHO.
Sure. Thank you so much for enlightening us with that one. If not sure, vaccine is going to be working for new variants. So why should we take the vaccine at all?
Yeah. Okay. As I already mentioned that. Now, still this vaccine, even if it is some people say, this vaccine is not going to work, or maybe questioning work with a new variant, that some sort of effectiveness still will be there for these viruses. Now, every day they are explaining the thing people don't understand. That's why I put that picture. The the mutation will not happen all total that spike protein, one simple part. So still some effect will be there. So you have to take the vaccine, and then only we can move forward.
Thank you so much. As for you, there are rumors going around, and one of it is the mRNA vaccine can cause infertility. Is that true?
No. Answer is no. There's no connection. That's not going to make any. That's not going to touch our sensible areas. Forget about that.
Thank you so much. Okay, mask will bring lung problems in the future, as some people say, because we are breathing our carbon dioxide, but we are exhaling again. So
That's
is there...
very interesting question. And Dr. Kantha also here. You know what, in that situation, we have to answer that question very carefully. You know, if you tell the people to use the vaccine, they use the mask, we have to advise correctly. Some people, they put the mask for maybe 2 days, the same mask, you know. So that is wrong. Actually, according to the guideline, you can't continuously use. You know, when we are in the hospital, we normally use the mask for a few hours, maybe 3-4 hours, and we change the mask. So the same situation for the general public as well. If they keep the same mask for 2-3 days, what will happen? They are breathing, and that will be collected. That can bring so much of other information as well. So they have to understand the concept correctly. Otherwise, yes, of course, that can bring some problem, you know, unless you follow the instructions correctly.
Sure. Thank you so much for that. So I think you already addressed it, but there's a question. Through the vaccine, electronic chip being inserted for continuous monitoring, there's a rumor going on. Can you please address that?
As I said before, without the fire, there will not be any smoke. Why did this come? The two reasons, because Bill Gates one day, he's a very nice chap, you know, basically when he was talking and he mentioned that maybe in the future, we might introduce an electronic chip. So you don't need to carry any of your vaccination card. So that will be put inside very tiny one. So you can keep all of your information in your hand. You don't need to carry anything. So he mentioned some of the things. That is one reason. The second reason is there's nothing to believe. People are thinking this vaccine contains some electronic chip. It's completely wrong. But after giving these vaccines, they will give you some sort of a vaccination card. You would have seen that. There's a small card. But in the future, they will create some sort of electronic, digital form card. Then they will put this information into that. So when you travel around, you can carry that. That is the thing. So people created the rumors because of that. Yeah.
Sure. Perfect. Thank you. So if we don't take the vaccine, what will happen? Particularly in BME community, we are having an issue. And I know that you addressed it.
Yeah, I addressed that. Yeah, of course. I'm really worried. So the current information, maybe a few weeks ago, maybe 1 or 2 weeks ago, only 25% of the people, they are not sure whether they have to take the vaccine or not. But at the moment, that percentage has gone up. The 50%, around 50% of the people think they don't know whether they have to take the vaccine or not, because they are listening so many rumors and the Facebook and all these social medias. Please take this. Otherwise, what will happen? The rest of the population will be protected with the vaccination. So this virus will search for an accommodation, rent, or maybe buy the accommodation. Thus, you are the accommodation, you are the resident. So that virus will come and catch within this community, and you will be affected more. Don't give the chance. By the time you will start blaming the government and the rest of the people. No, that's not going to work. Please listen to that. Take that vaccine.
Just to clarify for people who have joined outside the UK, BAME, that is Black and Minority Ethnic Communities, is a terminology we use in the UK to consider people who are from those kind of ethnicities, and why and that's the reason. Apologies, I should have explained that earlier.
Yes.
Okay, the next question is Pfizer vaccine might cause COVID infection because one of my friends had COVID after vaccine.
Wow, that's another myth. Yes, of course. Now you know that. I already explained the Pfizer vaccine. Basically, we are sending a piece of mRNA coated with some molecule, basically some lipid molecules like thing, and we are sending into the body. We are not sending any virus at all. That's not going to bring any infection at all. That will produce the spike protein. So we are not introducing any virus at all in that situation. So definitely not going to cause the COVID infection.
Thank you so much, Dr. Khan. I am going to open the floor to all the participants to ask the questions straight to the speaker, Dr. Khan. But one person at a time, please unmute only yourselves when you're asking the question. Let's not disrupt everyone else, because otherwise it will be difficult for the speaker to give you the answers effectively. Prior to that, I just want to answer again. We do have the talk show this evening, and it is Suja Correa, who is a solicitor of immigration, human rights, and nationality, who will be speaking about, is living together still a taboo. Over to you, the audience. Please take your chances and keep your questions short so that we'll be able to give opportunity for everyone to ask questions. Thank you.
End of life care plan for a 96 years old who had 2 doses of vaccine. The second dose, he took it only 7 days ago, and he was admitted with pneumonia, COVID pneumonia. But so my staff nurse, sister asked me, why is he had 2 doses? But I told he already had the disease. He was COVID positive December. So it was persistent. The lung damage must have been there, his age, frailty. So a lot of factors are there. And I explained to them, it's not the vaccine protected, it was a bit too late. Like many people, very elderly, who are having over 90s having vaccine, still some of them are coming and ending their life because they're already infected, unfortunately, before the vaccine. So I have to explain to them. So people should not put back that vaccine. Vaccine is definitely protecting.
Thank you, Dr. Kanta. Yeah. There's a question
sorry, 1 second. Can I add one point with Dr. Kanta? This is a very good point you mentioned that recently there was a rumor, some foreign country somewhere, I forgot that wherever it is because I don't remember those things, rumors. So maybe few people died, maybe elderly people died immediately after vaccines. Don't take it differently. What we did in the UK, over 80 years old or whatever, and they started to vaccinate everybody.
Yeah.
Some of them are on the way, okay, on the edge. They are suffering with so many things. Yeah. Some of them probably already had the infection. So after this vaccine, some people died. It's a very unfortunate situation, okay? We can't count it. That is because of the vaccine. That is a rumor they created. They wait for this situation, then they create this, rumors. Yeah, of course, please.
Sure. Okay. Thanks, Dr. Khan. Do you have, you have spoken about the 4 types of vaccines. So all the vaccines give the same protection, but I think you're kind of touched upon it, but there's a question there.
Yeah. Another question in the Zoom. Can we mix all the vaccines together and give a better vaccine? I love that idea, but unfortunately that will not work. Okay. It's not a cocktail, we don't want to do that.
There's also a question, I think you touched upon this, I think someone came late. What about Sinopharm vaccine developed by China?
Sorry?
Sinopharm vaccination from China. I think they perhaps missed that you saying that. I
already
know that
covered that.
mentioned. Yeah. Of course you did.
Same technology, and they are using the thing. Yes.
Of course you did. Yes. Okay. So if anyone wants to come and ask the questions, put the video on, and please come and ask the questions to Dr. Khan.
I can see Dr. Chellappa in the Zoom. He is one of the very senior physician. I'm very glad he's there. He can ask some question or some comment, Dr. Chellappa.
Yeah, I would love to hear from you.
You have to take your on the audio is on off.
You have to unmute it, Dr. Chellappa.
Can you please? Okay,
yeah.
fine.
Yeah. It's an excellent session. I enjoyed it very much because you have got rid of so many myths in our community. I think this is there should be a sort of wider audience, who will learn from this. And I think as Dr. Khan's presentation was good, and we should getting more people vaccinated. He mentioned from 25%, it has gone up to 50% people who are skeptical about the vaccine. I think we must try and recruit more people to have the vaccine.
Sure. Thank you so much.
Thank you.
It's a pleasure having you on the platform as well. Thank you. I will be editing this video. It might be tomorrow, and then put it on my YouTube, so then people can go and watch it. because we have another afternoon show. So, I am not a pro in editing, but I will try my best to do it as much
And
as
also
I can.
Dr. Balasubramaniam is there. He's a psychiatrist.
Okay.
Bala, you want to have any comment? He had his 1 vaccine or 2 vaccine? Yeah, the Oxford vaccine, he told me. Bala, you want to make a comment? You had to unmute yourself, Bala. So he is one of a very senior psychiatrists, and he's from our area, from Eastern Province, and
Okay.
charity work is involved. And
Okay. Don't we all need psychiatrists right now?
I have no specific questions as such, but there was some controversy about the AstraZeneca vaccine being not effective for people over 65. So I think you might have covered it. I might have missed it.
Yeah.
Would you like to comment further? Thank you.
Yes, yeah, I'll clarify more. AstraZeneca, when they do the research, the third stage of trial, and they included 8% of the population, the elderly population. So they believe we need more data. When you compare with the Pfizer, there's less number. So they want more data. That's why some European countries say, no, we don't want to give elderly people. We give that vaccine for younger people now. Then probably we will give those elderly people with the Pfizer or the Moderna vaccine. But same situation happening in the UK, whether whatever it is, same situation. But the research is going on, and basically they are collecting the data. Very soon we will get the proper data. By the time they will introduce that vaccine to elderly people. Believe it or not, some elderly people, they prefer the AstraZeneca vaccine, right? And they prefer that vaccine, and they get the thing. So far, nothing, no problem reported at all. And also, there's another interesting point I want to remind. Now, there was a story probably among the doctors and the medical staff is spreading. The company advised to give 2 vaccine doses and the 28 days apart. But now government is not giving 28 days apart. They are giving 3 months time. Now, interesting, another information has come maybe 24 hours ago or maybe 48 hours ago. And if you give 3 months interval, that efficacy has gone up to 84%. 84%. So that is much better when now the AstraZeneca, that efficacy has gone up to 84%. Previously, it was 70-75% after second dose. Now it has gone up. So the summary is there's not enough data for the elderly people to use. We are gathering the data. Very soon that will be changed. Then those European countries will accept. I think it's a fair information, a fair reason, because they are protecting their population. Yes, of course. But we have enough other choice. We can go for that.
Sure. Thank you so much, Dr. Khan. Thank you for asking the question.
Small thing, Ranji asked, she mentioned that can we mix 2 vaccines? That means what she tried to mention, can we mix AstraZeneca and the Pfizer vaccine,
Pfizer.
2 different doses? No, we can't.
Yes, that's what I am, Ranji.
Yes.
I've been a sort of GP myself as well.
Yeah.
But what I had to ask you, is that if one has had the Pfizer vaccine for the first dose, and then the second dose could be given as AstraZeneca, could that increases the immunity better than one alone?
No, according to the WHO document, it's in crystal clear, the black and white. So you can't mix 2 different type of vaccines. But maybe in the future, I don't know what will happen, right? We don't know that. Every day is a technology is changing, evolving, the information science is evolving. So that is a information. 2 days ago, I checked the WHO informations. That's what I gave. Maybe that will change maybe in the future.
Sure.
Thank
you, Ranji, for asking the question. Thank you, Dr. Khan. It was interesting to see the tweet from United Nations. What we touched upon on our talk show, actually, there will be 9 trillion sometimes businesses only, or even sometimes governments only understand the economic downfall, and cost to the global economy will be 9.2 trillion if the COVID-19 vaccination is not distributed internationally. The reason being, because if you think you are immunized and you are all right, and you don't have to immunize the rest of the world, you could be totally wrong. And it was really interesting this morning for me to see the tweet from UN putting it out there. Do you have a question there, Anand?
Yeah.
Yes, please.
No question, only the comments.
Okay.
I think good morning or good afternoon, Dr. Naushad Khan. I am really happy and proud of you. I would like to express my sincere gratitude for your excellent presentation. So I'm really proud of you because I am from Beticulo. You are also.
I'm from Beticulo as well. I'm from Kalmune.
Yeah, I know. That means our area.
Yes.
Okay. Anyway, you made a very clear picture regarding this subject, because I really appreciate your presentation. You considered, other than the medical professional, very clear explanations, because some doubt I had. I went through the doctor, the rumor article. I went through that. I had a doubt also. Very clearly you explained about it. Okay, thank you very much. Wish you all the best. Thank you, Menaca, to find a suitable person in this subject. Okay, thank you.
Thanks, Darren.
Thank you. There's a misunderstanding among the doctors. They are just treat the patient. Actually not. They have a big responsibility towards the society.
Yes.
Advising and educate the public also part of their role. If they don't educate, where are you expecting this education for this public? From the politicians?
Yeah.
Where are they from? So that is a very key responsibility. I normally take 50-50. My teaching and these things are 50% and the rest of the things are clinical. That's how I normally practice. Yeah.
Sure.
Okay.
Thank you.
Thank you, doctor. On the other hand, you are a good teacher as well. Huh?
Thank you. I'll tell my wife.
We will ask your wife later. I'm going to tell your wife one.
Dhanandan, can I ask you a question?
Please.
Yes.
Because Sri Lanka situation, I know a lot of all the health professionals and other frontline army personnel are vaccinated. Is there any talk about public getting the vaccination? Mainly the higher risk group of people. Is there any, have you had any, even Naushad can answer that, any information about it? How are they going to do that?
Yeah, the same questions.
They are going to do it.
Yes, same question read out that, but it was very clearly.
Okay.
The same doubt, yes.
Group of people.
Yeah, the age people getting risk, and some doctors also reluctant to do that. I came to know.
It is a most worrying thing. I think there are so many, I think a significant number of doctors
yes.
In the rheumatology specialized group. Okay. So very unfortunately. I think there's another person from Sri Lanka. He's my father's brother, the Akbar Ali, and she also from Sri Lanka. At the moment, he's joining here. That is the most worrying thing. If the doctors don't understand the fact very clearly, how can you educate the public?
My parents live in Sri Lanka still, and they're very much looking forward to getting it. And my dad is a doctor. Mom is also in, they live in Trinco, and they're looking forward. And as far as I have understood, the vaccination is going to be given for elderly and vulnerable people there. And obviously, it is up to them whether they take it on or not.
Because the Sri Lanka received only 500,000 vaccines. They need to cover both doses. They need 35 million doses. That is a 3.6 crores vaccines. So it's a very unfortunate situation. They are doing their best, and probably WHO also will help. And so we have to get the vaccine. We can't afford to lose that chance.
Sure. Thank you.
Right. I have a thank you slide, the last slide. Can I?
Well, let us be generous and allow you to do, of course.
We are in this situation. Okay. It's very touching photograph. for me.
Yes, it
Can
is.
you see that? This
Of course.
gentleman, he was an army. He was in the World War II, you know, and actually he is a father. The next person is a son. He's 98 years old. He is in that stage. He is unable to touch his son. So that is the situation we are living now. You can look at this picture. They are grandparents. They are unable to touch their grandchildren. You know, their grandchildren probably, you know, you can see that probably is 1 year old. Probably the child going through throughout this COVID, the mother is telling that is your grandmother. They did not even get the chance to touch. Can you see that? That is the situation we are going through. Only way we can come out of this situation with this vaccine. There is no other option for us. So we have to understand the reality, and we have to, you know, break our myth, and we have to come out of this. I'm going to dedicate this presentation to one of my colleagues. She is one of a very kind nursing staff. She had the COVID infection twice. And she was fighting for her life. She lost her life. So basically, she is not anymore with us. She died. So I want to dedicate this presentation to my colleague. She was one of our emergency medicine nurse practitioner. Thank you for her, and she is a lovely person. And if you want to ask any more questions, some people will be watching in the Facebook maybe later on. If you have any questions, still you can ask your questions. I have a Facebook public page, so you don't need to be a friend or maybe not necessarily, you know, the professional page. You can come through these facebook.com/Naushad Khan 2020. You can ask the question through that, or the WhatsApp, or the Instagram, or Twitters. Doesn't matter. I don't check Twitters very much. Preferably through this Facebook Messenger, so you can send the message. I'm happy to answer your questions. Thank you.
Thank you.
Thank you so much, everyone, for joining us once again and listening to us. After this, I'm going to come off the Facebook, and people stay back and network with Dr. Khan, us, and anyone else if you want to. For people who are joining from Facebook, thank you so much. Looking forward to seeing you at 3 o'clock London time to talk about is living together still a taboo. Until then, stay safe, be happy, and keep smiling.